Yeah. Good afternoon, ladies and gentlemen. I'm Dr. Narinder from Island Hospital, Penang, and as we all know, it is the Cervical Cancer Awareness Month, and I'm here this afternoon to spend this hour to chat with you and discuss perhaps a few cases and a little bit about uh, what's happening in Malaysia on cervical cancer and maybe a little bit on the prevention. Okay, without further ado, right? A moment. Yes, that one. Yeah. All right. Cool. I can't get it. Sorry. Right. All right. As we know, in Malay, actually globally, cervical cancer is was the number two cause of death among women, but after and this is for a fact and after breast. However, with the advent of the vaccine not too long ago, which was a wonderful breakthrough, it's become number three cause of death globally. Yes, but in Malaysia, as we know, at least 5 to 6 women are diagnosed every day in Malaysia with cervical cancer, and at least two of them succumb to it. Yeah, it is no joke. Uh, Globally, every 2 minutes, either a sister, a mother, yeah, a friend will die from cervical cancer. It's something we should we can prevent, and or if not prevent, we can reduce the numbers at least. Yeah. Statistically, as seen in this chart, uh, we can see that breast cancer is still number one cause of death among women in Malaysia, and followed by cervical cancer and then colon cancer. Yeah, and the age prevalence age period, that is most commonly seen is in the middle age to the elderly group between 60s to the 70s. Yeah, let me explain a little bit about where and what we're talking about in the first place, right? If you look at this graph, the cervix, which is which is in the vaginal canal, yeah, is attached to the uterus, which is the womb, and then the fallopian tubes and the ovary. This makes the female genital tract or the female reproductive tract. Yeah. So cervix is the lower part here, the circular one as seen in this graph. Even though it's connected, its diagnosis, its prevalence, its prognosis, and its management care is different if one is to succumb to cervical cancer or to uterine cancer. The management care is all different. Yeah. And the best way, as we know across the board, is prevention. And prevention is screening. So I'm here to make this aware to you all. For those guys, men who are there out there listening to this as well, it is just as important for you to know as well, for your wives, for your daughters, and for your sisters, etc., etc. Okay. In the next slide, you can see that in a nutshell, the womb is divided into the cervix, which is the lower part, and the outer parts are the ovaries. Yeah. Okay. In the region where the cervix lies, there are two cell groups that meet around this region. Yeah. In this region, it's called the transformation zone, and it is uh, it is a junction really between squamous cell and glandular cell. Okay, this is where the mechanism of repair actually happens for the woman who has changes in this area. For example, when we say trauma or an insult, may it be from intercourse, may it be from having your menstrual cycle, may it be from your exercise, your vigorous exercise friction, yeah, or childbirth. The repair is altered and done in this region called the transformation zone. Looking at this area of the cervix, it is then subdivided into the ectocervix and the endocervix. Yeah, the ecto, which is the outer, endo, which is the inner. Okay, if you look at the picture of the normal cervix on the right side of the slide, you see a tiny little hole in the center. This is the tiny hole that allows the menstrual cycle to come out. And this tiny little hole is the one that will dilate if you were to be pregnant to 10 centimeters to allow your baby to be born. Isn't it an amazing organ? So let me continue. What are the main and major? There are many causes, as we know, but of late, and I say if of late, is in the last couple of decades, really, we know that one of the major causes of cervical cancer is by a particular virus which is known as human papilloma virus, or we commonly call it HPV virus. Yeah, HPV. And HPV is has got has been around, you know, and it's got many subtypes, like how you would name, say, your children A, B, C, D, E, or whatever. So we have typed it as type 1, 2, 3, 4, 5, and it goes on and on and on and on. Yeah. So out of this, all these numbers, yeah, only 30 to 40 play a major significant role, and in the region of the genital tract. Okay. Uh, about 20 of them are the troublemakers, really. They cause cancer of the cervix, and this is what we are focusing on, right? And we know out of all these numbers, number 16 and number 18, yeah, take up about 70% of all cervical cancer uh, pathology or causes, yeah. There are many other subtypes that also do cause cervical cancer. However, 16 and 18 are the major two, right? How about 6 and 11 then? 6 and 11 is responsible for genital warts. And genital warts, we know, do not convert to cervical cancer. So I am just mentioning it here. You may get warts in the finger, as a child, or in the foot. These are also HPV that caused warts, yeah, but they do not turn to cancer. Not only does it attack the cervix, where the region of the transformation zone, the anus can also be involved. The vaginal walls can also get involved, the vulva included. And all this can lead to a cancer or malignancy if there is persistent infection. The key word here, ladies and gentlemen, is presence of the HPV virus, persistent infection, and persistently sitting there. All right. So if one was going to ask, how does one get this virus? Okay, is through sexual contact? Yes. We all know for a fact that uh, studies globally, yes, tell us that most of us get it through sexual intercourse, whichever route it may be, yeah. And we also know that the nuns, for example, who are in the nunnery or the churches and all that, they don't have high. They are exposed to HPV virus, however, not genital HPV. All right, that is the significant difference. Okay, and we also know condom can protect to some degree. A barrier method condom can prevent, but not totally. All right. There are other methods where this virus can spread to an individual, especially from the mother to an unborn child, or from, say, using toilet seats, sharing undergarments, touching non-hygienic or unsterile dirty things, yeah, is one other method of getting the virus, yeah. Yeah, we are also worked up about COVID-19 at the moment, but yes, it is alarming, it is a real thing, it is perhaps for some of us scary and a wake-up call, but HPV virus is just as important and has been here for a very, very long time. And the natural history, as we know, is basically it takes time. So the key word here, as I mentioned, is having the virus present in the cervical region persistently, yeah, causing changes in the cell transformation, which we doctors call CIN. Yeah, and CIN is classified under precancerous 1, 2, and 3 before it becomes cervical cancer. So if you are classified as a CIN 1 or a 2 or 3, yeah, you can be the next step, or you can be high risk to getting cervical cancer. Yeah, but it doesn't label you from getting it. It does not label you from getting it. Yeah. However, once one gets diagnosed with cervical cancer, then the treatment and the management care is more complicated. Yeah. Okay. Okay. If you look at graphically the picture of how a cervix looks like in this picture here, in this graph here, after several years with persistent infection, yeah, persistent infection meaning presence of erosion or atropine seen at the cervical mouth, yeah, or mulut rahim, sekiator, yeah, which will convert the cell group. Remember the factory that forms the repair happens here. So the virus incorporates into this factory production, putting and altering the DNA, causing the cell change. And the cell change will take time over the years to low grade and CIN1 and high grade CIN2 and 3, and if it's ignored, subsequently and inevitably cervical cancer. Again, the picture from something looking so simple, so probably just looks like a little blister really on your finger, yeah, But this is the part of the cervix to something so nasty and so difficult to manage can happen if it's ignored. However, if we know it is preventive, and I'm going to tell you in a short while how to prevent it. We all know and we've all heard from our famous actor, singer uh, called Anita Mui. She died from cervical cancer, and actually, there's so many others who have also succumbed to it. Eva Peron, uh, well, can go on and on actually. Yeah. So, how do I know that I have cervical cancer if you have not had any symptoms, or what are the symptoms, or have not gone to see a doctor? Well, number one, normally the symptoms or the signs that normally that you might uh, experience will be abnormal bleeding, right? If you imagine that your menstrual cycles were regular, anything that any bleed, may it be, a spot, may it be a clot or altered color, is always significant. Yeah. And if it's recurrent, it needs to be attended to immediately. Yes. So any bleeding after having sex or intercourse, please don't disregard it. And especially for those wonderful ladies who are in their golden years, if you're experiencing even a drop of blood during after being menopause, please get yourself checked up immediately. Yeah. Yeah. I was just checking the time. We're good with time. Yeah. Other than that, you may have also vaginal discharge. Most women in their reproductive age group will experience, you know, mucus discharge. How do I know it is a infection? How do I know it's a problem? It is an infection when it is of foul smelling. It is an infection if it is causing irritation to your private part. Simple as that. Okay? Don't ignore it. Yes. Other than that, you may have leg pains, pelvic pains, and other symptoms such as bleeding from the bladder or the rectum. However, like all other diseases, some even don't even have symptoms. This is how a normal cervix again looks like, and on the other side is how the tumor grows, yeah, like a cauliflower from the cervix coming downwards to the vulva area or going upwards towards the uterus, to your womb. Yeah. Yeah. Look at this graph here. It can occur from a tiny dot of the cervix here, and it can go downwards, or what we call posteriorly, to the rectum, which is your anus and your rectum behind. It can go up anteriorly where your bladder is sitting, and these organs are very close to one another. Okay, if we are having these symptoms and we are uh, worried about it, we go and see a doctor or a nurse, and she recommends that you do what is called a pap smear. Yeah. So from the pap smear, the report comes out to be changes seen in the or abnormalities in the cell, for example. Yeah. So depending on the severity, then the treatment options may vary. Yeah. When you get CIN 1, 2, 1, most times it is self-limiting. That means your body has antibodies, it will heal by itself. But if it's left alone, it will turn to 2 and 3, and this will require what is known as a simple procedure called a cone biopsy, where we just cut off the affected area. Remember, this is precancerous, and all that we have to do is that, and your cut area of your cervix will grow back again in 1 month, and you'll be back good as new. Yeah, followed by your regular pap smear. Yeah, for those more extensive, of course, you need to remove the whole womb with your lymph nodes, followed by radiation or chemotherapy depending on the cell type and the severity. Okay. If I have HPV, does it mean that I will get cancer? The answer is immediately no. It doesn't mean that you will die or you will get cancer. Okay? Among all of us in the population, we're all exposed to all kinds of viruses, and HPV is one of them. Remember, the virus goes away by the immune system in our body. Yeah? It is the women with persistent infection that are higher risk. How common is it? Well, CDC in the US has recorded up to 80% of the population, men and women, yeah, who are sexually active, and and more than 75% of women who are sexually active and who are, have been tested positively with this HPV virus present and are normally in the reproductive age group. Oops, sorry. In the reproductive age group. Yeah. And these are the years that matters a lot. Who is at risk? You, me, I, him, her, all of us. All women who are sexually active, women who have had more than one partner, women whose partners are more than having more partners. Yeah, you should be aware of that. And those women who are immunely suppressed. For example, those who have steroid medication, who have organ transplantation, who have HIV infection, chemotherapy for whatever reason. Yeah, these are the women who are higher risk to get this HPV virus. Yeah. So how do I lower my risk? Delay onset of sexual activity? Yes. Know your partner's sexual activities. That would be good. Stop smoking. We all know smoking is bad, bad, bad. You know. Uh, Good lifestyle, healthy diet, and practice safe sex. Okay. Now I should add that and stay home as well. Yeah. if you've not focused on what I've said, at least take this take-home message, ladies and gentlemen. Please get a pap smear done on a regular basis, at least annually, once a year, and get yourself vaccinated. In Malaysia, I am proud to say that the Obstetrician Gynae Society of Malaysia have advocated Ministry of Health, uh, if I'm not mistaken, now at least 8 to 10 years, yeah, to vaccinate all teenage girls for free, yeah, in schools. And how about the boys? Do they need vaccination? Of course, they are exposed to HPV virus as well. But boys don't have a cervix, so they don't have cervical cancer. However, they will eventually have partners who are females, and then if they can give that HPV virus to their partners. Yeah. Let me mention a little bit about pap smear. It is if not the only screening test. I mentioned again screening test on the human body, yeah, here women, where we can detect the presence of abnormal cancer cells before the organ turns to cancer. All right, it is a very simple test. It takes less than 2-3 minutes. It is not painful under trained hands, and we can actually detect the presence of an infection or the presence of precancerous or early cancers. And graphically, this is how it looks like. Yeah, it looks a bit scary. We put in a gadget called the speculum, yes, to visualize the cervix through the vaginal canal, as you can see here. And we use a brush and we gently rotate around the cervix at the mouth, covering the area that matters. And we put it on a slide or in a little bottle, and we will get the result within 24 hours. Simple as that. Yeah. In Island Hospital, you'll get the result in uh, in the next day actually, and it only costs the tin prep. It only costs about 80 to 90 ringgits, so it's pretty affordable, yeah, and it might save your life. So when do I need my pap smear, and how often should I get a pap smear? Question which is always being lingering in everybody's mind, yeah. Theoretically, a pap smear should be done once you are sexually active. Yeah, any woman sexually active. Yes, whatever your age group may be. Yes, and say you're sexually active, and then after that, say non-active for many years, you are still considered high risk already, exposed, and you will require regular pap smears. Okay. It is recommended that if two subsequent pap smears in the two subsequent year, forgive me, if the subsequent two pap smears that you do turn out to be normal, then screening can be stretched every 3 years, one time. Yeah. Well, since I'm here, for those above the age of 40, I would highly recommend a mammogram as well. This is the detection for breast cancer. Okay. One would say, I feel fine. So why do I need a pap smear in the first place? It is a screening test. So, and we also know that the virus can be there even though there are no symptoms. So, get yourself checked and get a pap smear done today. Why do I need to keep getting tested? Because the test is only a screen. It is not 100%. It's not perfect. Yeah? Okay? Um, so, the cells can also alter from months to, for some people, from varies from months to years. So if the cells are going to change, we are going to catch it before it becomes malignant. Okay. And if we find that the pap smear is abnormal, then we move on to more complicated or more definitive tests like the HPV testing to know what virus is actually causing it. Some of us repeat the pap smear, maybe not 1 year, but 4 to 6 months. A colposcopy is basically putting a camera, like seen in this picture here, and we do taking a little pinch biopsy from the cervix. And this will tell us whether it is present or not. Other than pap smear, ladies and gentlemen, don't forget, we have now in Malaysia, the vaccine. And the vaccine is present since the year 2006. And we know there are two major companies that actually carry this vaccine. Yeah, you've heard of Cervarix, and you've also heard of Gardasil. Yeah, both both these vaccines are good, and they cover the subtypes that cause cervical cancer. Yeah, and the latest and the newest of them all is Gardasil 9. Yeah, and it covers 9 subtypes. The main ones are 16 and 18, followed by 31, 33, 45, 52, and 58. And these are the ones that make a difference, because if you are an Asian woman or a woman who's living in Asia, then it will matter more to you because it has been found in this region at high numbers. Once again, little bit information about the vaccine and its arrival in Malaysia and how it is given. It's normally given in the arm, into the muscle, a little pain, like an bite maybe. However, the latest literature tells us the recommendation. Let me tell you, the recommendation was zero. Zero meaning on that time that you see a doctor and you get your first dose, followed by the following month and the 6th month for the group of women within the ages of uh, 15 or 16 above. And for those who are below that, The teenagers, the 9 to the 14, the evidence shows that only 2 doses suffice. So you can save if they're given in that age group. Okay. So there are many. This beautiful diagram shows that so many of them. So we have virus. It's the same tree. It belongs from the same tree, but with different names. And only a handful are the troublemakers or the ones that cause problems like cervical cancer. This right, this is to tell us that how some of the tiny branches and how they are related. If one gets a type 18, for example, then you are there is a possibility that you might get the 45 as well. Yeah. Okay. So, can HPV cause cancer other than cervical cancer? Yes, it can. It can. And it can cause actually nasopharyngeal cancer. It can cause throat cancer. It can cause vulva, as I mentioned, vagina, anal cancer. So all these regions, like the anus and the nose, the throat, even men are susceptible. Okay? How do we treat HPV infection? The best way, remember, screening, 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 and vaccine, vaccine, vaccine. Yeah? At least it will save your life, or your sister's life, or your wife's life. And that's what matters. Should I still screen for HPV if I have little to no sexual activity? Indeed, it is important. If, as I told you, you have been exposed one time, you've had an intimate relationship, you are high risk. So don't think that you're not high risk anymore. Please get yourself checked. If not every year, every third year. Yeah. A lot of people are concerned when they see a genital wart. Oh, that's going to turn into cancer. But the answer is no. It is actually it is a pain. It's another type of infection by the same virus, and it spreads very fast. It is very easily treated, but it doesn't convert into cancer. Okay? Can HPV or genital warts affect fertility or pregnancy? Well, if there is a tumor there, yeah, and it causes alteration and an infection that persists, it can cause problems of fertility, and it should not be ignored. Yeah. So for those who are embarking in a pregnancy, yeah, make sure you are healthy before you do it, before you go and attempt to get into conceiving or getting into a pregnancy. Yeah, have a healthy lifestyle and get yourself checked. A simple thing as a pap smear. Is it possible to be reinfected once you get HPV? Yes. It's like any other virus. It's like the flu virus. It will come, it will go. Yeah. However, if we don't want it to be persistent and we don't want it to be sitting all the time at the cervix, that's the that's when problem happens. With that, I thank you for listening, ladies and gentlemen.